Okay. Can everyone see that? Is that okay?
Yeah.
Yeah.
Okay. Okay. So as Anna said, I'm Debbie. I'm a nurse consultant in gynaecology, and one of my clinical focuses is menopause. So I'm going to do a quick an overview, a run through of menopause. So we're going to look at what menopause is, going to look at diet and lifestyle around menopause and how that can help with some of the symptoms, alternatives, complementary therapies, and then very briefly touch on hormones. And if there's any questions about this, I'm happy to take them. And I'm also happy to take any questions about any other aspect of women's health if people have got them as well. So this is a survey that the British Menopause Society did a while ago now, but was looking at how women found menopause. And it's suggesting that 45% of women find that work can be a struggle when they are menopausal. And that interestingly has left to some women being taken via HR or down disciplinary routes for non-performance of jobs or not being able to do things. And that relates to some of the symptoms that we will come on to. 51% found that sex can be painful. And also about 30% found that they didn't want to do things. So their social lives were different. They didn't want to do things, didn't want to go out, found that their confidence had gone, found that where they used to be able to go and do things, they couldn't do them anymore. And then there was also partner problems as well. And then following on from that, the Faculty of Occupational Medicine has looked at menopause, which is becoming an increasing problem, as it says there, by 2020, which has gone. 1 in 3 British workers will be over the age of 50. So that is 1 in 3 British workers, if they're women, working postmenopausally. And the postmenopausal period now for women goes around to from 50 onwards. So as life expectancy gets more, that can be up to working for about 30 years or so in a postmenopausal state. And if women's menopause isn't taken seriously at work, there's lots of studies that suggest that women are more likely to quit their job, to be less satisfied and less engaged as well. And the other thing is that women are unlikely to disclose the problems of menopausal. So particularly if their manager isn't one that has an open workplace where things are discussed like that. There are some studies that women feel that there's lots of jokes about women being old or menopausal or having flushes and things, and that makes them much less likely to disclose when they're having serious problems with menopause around the work, and feeling less confident as well, feeling that professionally they're passed over for promotions and things. So menopause isn't an illness. It happens to every woman in some degree. It doesn't happen the same to every woman. So some women will have no symptoms at all. Other women will have symptoms for 20 or 30 years past the last period. It's not an illness with the exception of having a POI. So that's premature ovarian insufficiency. And that's menopause under the age of 40. And after having treatments for things like cancer where we cause the menopause, then there's different expectations there. Menopause is often under-recognised, undervalued and not taken seriously, and the symptoms last longer than the anticipated. So most people think that after a few years the symptoms will have gone. However, the symptoms can be there, as I've said, 10, 20, 30 years afterwards. And the psychological symptoms are the ones that affect women the most, and they're often the ones that are poorly identified. So we find around the age of 50, a lot of women will be offered antidepressants by their GP for mood changes, rather than maybe some hormones, or maybe looking at the cause, which is sometimes menopause rather than depression as well. So happens again, common. It has an impact on both life in general and just work as well. For some, wide range of symptoms which we'll come on to, can be a very emotional time. So a lot of women find it very difficult to cope, bursting into tears for no apparent reason, getting angry for no apparent reason as well, and becoming sad for no apparent reason. Not often talked about and not often linked to work, but can be made worse by work environments. So high temperatures, uniforms, the police particularly have done a lot of work looking at their uniforms because they weigh a few kilos and they can make the flushes worse. And then high temperatures in offices, etc., not having access to fresh water and having access to fans or being able to open a window. So in the UK currently, the average age of menopause is about 51. Premature menopause, as I've said, is under the age of 45, and premature ovarian insufficiency is 1% of the population that's under the age of 40. The youngest woman we have in our menopause clinic currently is 14, and our oldest patient is currently 89. So the needs of someone in their teens, in their 30s, 40s, or 50s is obviously very different to the needs of someone in their 60s, 70s, and 80s. But all those needs are there. So, which is why we think menopause is such an individual thing and needs to be taken individually. There's lots of terms around menopause. So perimenopause is the period leading up to the final period, when the periods start to change. So it might be missing a period every now and again, or in summer when they just stop. We say that someone is post-menopausal when they haven't had a period for a year. So that's a retrospective event looking back. Menopause can be natural, so it happens naturally, surgical or induced. So by surgery would take over as a way, or induced with chemotherapy or drugs. And it's defined as the loss of ovarian function, so the ovaries stop to produce an egg, which leads to a decrease in estrogen, no periods, and an increase in two other hormones, FSH and LH. And all of that ties in to lead with the symptoms, such as hot flushes, etc. So the questions we're often asked, how do you know if you're in the menopause? Well, most people have some symptoms and their periods become erratic. You know that you're in it if you've got symptoms and you've not had a period for a while. The next question we're asking is how long will it last? And as I've said, it can last for a very long time, or it can last for a few months. And how does it impact on me? And again, that's very individual and that depends. So knowing the symptoms and arming yourself with the information about what's the menopause, to be able to know what things are impacting on you. The main thing that we would say in general is be kind to yourself. And as I said, know the symptoms so you can work out how to handle them. Be aware that there's no one size fits all. So there's lots of information out there on the internet, some of it good, some of it bad, about different things you can try, different things you shouldn't try. It is trial and error, and it's finding a combination of measures normally that work for people. So there's not one thing that you can go into somewhere, pick off the shelf and take, and it will work for all the symptoms. And all of the symptoms have different things that help with them as well. So the symptoms, 80% of women will suffer with some symptoms and 45-ish to 50 find them distressing. Only about 20% of women seek treatment for them. And some of them, the short-term symptoms they're called, so that's the hot flushes and night sweats, particularly the night sweats. They're called short-term and they're called harmless, but if you were a man and you didn't sleep for 6 months, your GP would take that seriously and do something about it. So they're not necessarily so harmless. And some of the hot flushes and night sweats that happen early in the perimenopause have been linked with cardiovascular disease later on as well. So they may be a marker for things to come. So this is my very depressing chart about the different menopause symptoms that you have. So the most common ones are the hot flushes and the night sweats. So the body perceives you to be too hot, so starts a process to cool you down. That involves the hot flush, involves the sweating, becoming red, sometimes the shivering, sometimes increased pulse, feeling a bit faint, some nausea, not sleeping because you get woken up and sleep disturbances. Leading on from that, you can have psychological effects as well, and they are related to hormone changes. So nervousness, anxiety, mood changes, being irritable, some confusion and depression, forgetfulness, poor self-esteem, and problems with memory. So these can be there in their own right, but they can also be there if you have night after night of not having a good night's sleep because of the hot flushes. And then there's the psychosexual changes, so decreased libido and fatigue as well. Other symptoms include changes in the periods, changes in bleeding, skin changes, so the skin and hair can become dry, nails can become dry. Some women say they feel that they've got insects crawling over their skin, but there's nothing there. Joint pains as well, particularly in the hands and feet, bloating, and weight gain, particularly around the waist, and changes with hair. And then we've got the changes in periods as well. So the periods can be shorter, they can be longer, they can be heavier, or they can be lighter. So any change you want. In the bladder and in the vagina, there are estrogen receptors. So eventually, the lack of estrogen in the vaginal walls makes them become thin. The vagina stops producing secretions, so it becomes dry. And with the thinness and the dryness, it can be painful when you have sex. And also more at risk of vaginal infections as well, more at risk of passing urine more frequently as well, as the bladder becomes irritated with a lack of estrogen. And then there's decreased libido, and that can be one if it's painful when you have sex, and you bleed when you have sex, it does tend to decrease your libido because it doesn't seem enjoyable, and also non-hormonal problems as well. So depression, stress, etc., not sleeping. So there's a whole range of symptoms there. Okay, so what you can do, so some practical things, is to keep a diary or a log, look at the symptoms, look at your feelings, look at what food you'd had as well, and what activities you had, and see if there's any triggers. So for example, someone might find if they have a glass of red wine, they get a very bad night and lots of hot flushes. However, if they have a glass of Prosecco, the night goes well. So coffee is another trigger as well. So can just generally hot drinks, eating late at night. Some people find if they eat at 9 o'clock, they know that they're going to have lots of hot flushes and night sweats that night. So you can look at what you do and see what happens. If you discover that red wine is a trigger, and that's very unfortunate if you discover that, it doesn't mean that you don't ever have any red wine. It means that you know that that will trigger things. If you discover that eating late at night is a trigger, then you can adjust things. Also be aware of things that are going on with family, environment, stress, etc. as well, because they can cause symptoms too. Keep a track of the symptoms, keep a track of your periods, be aware of what's changing, what makes the symptoms worse or better, and don't put up with the symptoms. Go and get some support, or go and find some information online and see what can be done for them and what ones are your most pressing symptoms. So there's lots of things about how we diagnose menopause. So we diagnose menopause, one, on symptoms, which is the predominant one. Secondly, on age. We don't tend to do bloods because the female hormones FSH and LH and estradiol change in the cycle. So if we did everyone's bloods on the call from now for about a month, we'd find that the levels were different each day. They're very unreliable. And we find that in a perimenopausal woman, so someone that's having symptoms but still having some periods, the bloods can be normal, and then you often get told, oh, you're not menopausal, it doesn't matter, and it can't be that. So it's best we don't do the bloods, apart from for people under 40. It's also important to remember that even if your periods are becoming infrequently, contraception is still needed as well. So we say that you need to use contraception till you've not had a period for a year if you're over 50, and 2 years if you're under 50. The long-term symptoms of the menopause, so the shorter ones are all the ones that are familiar, but osteoporosis. So 1 in 3 women develop osteoporosis, and you get your best bone in about your 30s. So after the menopause, it decreases by about 5 to 6% a year. Some people lose bone quickly, some people lose bone slowly, but the prevention of osteoporosis is very important. So it's best to have a good bone to start with, and then look at activity. So walking is really good, any weight-bearing exercise, diet. So that's a good amount of calcium and vitamin D and protein, not smoking, not having too much alcohol, and decreasing the weight because that's good for your bones, and trying not to fall over, because obviously if you fall over or don't fall over, you have a decreased risk of fracture as well. Okay. So if we're going to carry on, we'll look at lifestyle, as I've touched on, a little bit about hormones, but then alternatives and complementary medicine as well. So the hot flushes seem to be the predominant ones. So things about staying cool. So some people keep a spritz in the fridge. They have a bottle with some cold water in it, or some floor water that they take out at night, take up to bed with them, or take when they're going somewhere, and just spray cold water onto the face. You can use, there's commercial products available as well. So the menopause is a money-making scheme for a lot of people. So there's a company that have made some special facial spritz for menopausal women, and it costs about £15. If you look in Boots and go to the holiday section, there's some chilled water for prickly heat, and it costs £1.99. So you need to look at things like that. So that's that's made cold already, so it comes out cold. So you can spray that over, and that can help keep you cool. A chiller pillar is something that's widely available. It's got cold in it. It doesn't need any water put in it, and you put it under your pillow at night. Supposedly it keeps the back of your head cold, so that it reduces the severity of a flush if you have one at night. It works for some people, but not for others. Wearing bamboo fibre or wicker fibre, and that can be in bed linen, or that can be in pajamas or nighties or underwear, and that absorbs the sweat if you have a night sweat, so that you don't wake up then feeling cold and shivery. Having clothes in layers, so not having one thick jumper that you can't get off, because when a flush comes, we know that anxiety makes them worse as well. So if you're worried about a flush and then a flush comes and you've just stood there in a meeting in a hot jumper, that makes it worse. So having lots of layers of having natural fabrics. A fan, if you can tolerate it, or have one at work. They've got little ones that plug into computers or on the desk, and then adequate ventilation. So ventilation at night as well in the bedroom. Generally, we suggest keeping the weight down. So we know that women with increased weight have more symptoms, and particularly the hot flushes, have more joint pains, have more problems with heart disease, cancers and pelvic floor. So we suggest the weight for all sorts of reasons. Limiting alcohol, it can increase your symptoms, and it is bad for the heart, bones and sleep. So people that do drink a lot of alcohol particularly can find that their symptoms are bad, but they don't get very good sleep quality as well. And caffeine, again, impact on sleep and can trigger symptoms. A good diet, for all sorts of reasons, overall health as well, but with the calcium, with the proteins and the vitamin D as well. Some foods with phytoestrogens in, so they're plant estrogens that are in things like tofu, soybeans, flax seeds, etc. They may help with some symptoms, although some women find they have to eat quite a lot to get any benefit from the symptoms themselves. Omega-3 is good for the skin and the joints and the mood. Eating regular 3 meals a day, so the blood sugar changes quite a lot in the menopause, and it can drop quite suddenly, and this triggers a craving for chocolate or snacks and things, which obviously isn't good because it doesn't sustain the blood sugar for a while. So snacks if needed, but healthy snacks is needed. And tryptophan, which I can never say, which is a serotonin and found in some fish for mood. Keep moving. So it's good for your bones, it's good for your heart, it's good for sleeping as well. Look at if you're having problems with sleeping, look at how you sleep. Look at if you've got TVs and phones in the bedroom, look at CBT for sleep as well. And then smoking again. Smoking can bring menopause on earlier and make hot flushes worse too. Stress. So we know a flush comes, you're worried about the flush, it makes the flush worse. So some techniques that look at breathing can be useful. So there's a book there by Myra Hunter and Melanie Smith, which is managing hot flushes and night sweats with CBT. So that's non-hormonal. It's a 4-week course where it guides you through how to think about the menopause and how to think about things. It's also got some very useful information about menopause, and that can help with hot flushes and night sweats, but also it helps with mood as well. Yoga, Pilates, mindfulness, all good breathing techniques to have, particularly when you have a flush. Taking time for yourself, important to reflect on what you can control and what you can't control, and try and deal with what you can, and try and learn to let things go that you can't. And equally, brain fog is something that lots of women complain of with menopause, not being able to remember words, not being able to think about things the way they used to, having to use lots of lists and notes. Some of the research suggests that doing something new that you enjoy is good for your mental health and keeps your brain active. So some people say things like salsa dancing or tangoing, because you have to think about the footsteps, doing things like crosswords, etc. And a square of very dark chocolate a night is supposed to be very good for your brain as well. So you can all have a nice square of dark 70% chocolate. Treatment. So I've put don't be afraid of HRT, but I know there's some issues with hormones and stuff, but we can just park that to one side for now. Look at alternatives. So some herbal supplements may help. Most herbal supplements are sold as food supplements, so they don't have the research behind them. So you do, if you are taking other medication, need to know what you're on and discuss it with a pharmacist before taking them. If you are going to take herbs, it would be the same advice that I'd give to anyone taking any product. Take one product. Don't have a combination product. So some things have got multiple different herbs in them, multiple different vitamins and stuff. You need to take one thing that you know what's in it. It needs to be pure. It needs to take it for at least 3 months to see if it helps. If you went into Holland & Barrett and Boots, I don't know if any of you have looked at the shelves for menopause, because there's multiple options there. Some of them are the same under different brand names, so you need to be looking at the ingredients to see what's on them. And some of the things I'll cover in a minute, different things we've got. if herbs and lifestyle, etc., aren't helping and you can't take hormones, then there are 3 different alternatives that you could potentially have. One of them is called clonidine, which is a blood pressure medication, and it works for about 30% of women that take it for hot flushes and night sweats. It can lead to some problems with sleep, and you can't use it if you're using other blood pressure medication, but it may be worth looking at. Otherwise, we do sometimes use a very small amount of an antidepressant, so we wouldn't use it as an antidepressant, and it wouldn't be suggesting that someone is depressed. We would be using it as a very small amount for its side effect, and the side effect is to sort out hot flushes and night sweats. It can have problems with GI, so you can feel a bit nauseous and a bit of dry mouth as well, and it can interact with other medications, so some people can't take it. And then the other one is gabapentin or pregabalin. Again, these are medications for pain and epilepsy, but used in a small amount, they can help with hot flushes and night sweats, and they can also help with some of the joint pains as well. And the last 2 help with about 50% of people that take it. Okay, so if we move on to the alternatives, so as I've said, we need to know what's in them. We need to know how does it work, and is there any indication for it, and how much does it cost. So there are several leaflets around. So my go-to website would be Women's Health Concern, which is the patient side of the British Menopause Society. So all their leaflets are written by people that are specialists in menopause and clinician reviewed. The other place is the Royal College of Obstetricians and Gynaecologists, who have a menopause hub as well with leaflets on there. And they both have leaflets about alternatives. Women's Health Concern have leaflets about menopause and absolutely every single thing. So hair loss, insomnia, thyroid. The bottom half of my screen is a very quick internet search to see for ideas for menopause. So Menopause, Promazil, one a day, isoflavine, Zycol. Most of these are all very much the same. So they're either soya or they're red clover. Alternatives, so osteopathy, hypnotherapy, aromatherapy, chiropractor, Alexandra technique, nutritional therapy. Acupuncture has got mixed evidence about it, as women say that if they have acupuncture, it doesn't help their hot flushes particularly, but they sleep better and they have better quality of life. Homeopathy's got mixed evidence as well. Reflexology is mixed. Yoga is quite good for the breathing and flushes, and counselling and meditation and CBT. And then onto the herbs. So red clover, high dose red clover is one that has some evidence behind helping with hot flushes and night sweats, and no long-term impacts on anything else. Isoflavines that you can get from beans and plants, but you have to eat quite a lot of them. Ginkgo for memory has no evidence. Soya again has some evidence, but some people don't want to eat a lot of soya because it is a plant estrogen. Vitamins, as I've said, vitamin D for bones, calcium, vitamin E for skin can help, but it doesn't help with hot flushes. Black cohosh is a herb again that can be used for menopausal symptoms. Angus castor, St. John's wort, interferes with lots of things. So although it does help with hot flushes, not necessarily recommended depending on medication that you're taking. And sage again is a plant estrogen. So some people drink sage tea. There's a thing down the bottom called the Lady Care Magnet that I don't know if anyone's seen or tried. No, it's about £30 and it's a magnet that you put on your knickers to magnetize your pelvis to stop the hot flushes. So no evidence, and reviews are completely mixed, from it worked great and sorted everything out to it didn't work at all and my leg fell off. So you can try, but there is obviously there's no trials behind it, so it does work for some people. So HRT is given to some people if they can take estrogen, and it helps for hot flushes, night sweats, etc. We give 2 forms. We give estrogen, we give progesterone, and we do give testosterone because ovaries do produce testosterone, which is a male hormone, and that's sometimes helpful for mood and libido. We give HRT in different ways. So if people are still having some periods, they get it on and off, they get it in a cyclical manner to mimic the periods. If they've stopped having periods, they have estrogen and progesterone altogether. And if you've had a hysterectomy, you have estrogen. So this was a general slide about breast cancer, but also related to HRT, but also for everything else, just to show the risks of breast cancer in in the UK population, and things that make it better and things that make it worse. So exercise makes it better, and smoking and drinking make it worse. So we'll not go into that one. Something that I think we could safely say you could have would be if you're having lots of problems with the bladder, lots of problems vaginally, painful sex, and painful vagina, so pain when walking, etc., would be vaginal estrogens. So vaginal estrogens come as pessaries and come as cream and ring. They are used every night for 2 weeks, then twice a week after that, and they equate using vaginal estrogens for a year to being the same as taking 1 day's worth of HRT. So it's a really tiny amount that you have over a year. We do give it to women with breast cancer that can't take hormones generally. So if the symptoms are quite severe or uncomfortable or just generally quite depressing, then that would be something that I do think you could take, because it doesn't get systemically absorbed around the body. So if the symptoms are mainly vaginal. Otherwise, if you didn't want to have estrogens for those symptoms, then there are lubricants and there are moisturizers as well, vaginal moisturizers. So the lubricants, sometimes women use them for sex and sometimes people use them all the time just as for walking around, and they can be oil-based, water-based, and there's different ones. Lots of companies have them in different forms. The companies Silk definitely send samples, and so do Yes as well. And then there's moisturizers, which are used exactly the same as if you use a moisturizer on any other skin. So you put them into the vagina and you put them in once or twice a week. And again, the companies will send you some samples around. Yes is the one that's most female friendly and doesn't seem to have any impact on the vagina or causing any infections or anything. And I think so. There's quite a few resources out there. So Manage My Menopause is a clinician's website where you can put your information in and they'll give you a printed out report of things you can do. The Daisy Network is specifically for women under the age of 40, and again is a very good resource for them. Menopause Matters, a clinician one website, lots of advertising on there, but actually all the content is clinician run. Women's Health Concern I've mentioned. The Royal College of Nursing has got some publications on about menopause and menopause at work, etc. And the British Menopause Society is for professionals, but you can see if there's any news about menopause and things, that's normally on the front of their website.